10 U.S. hospitals, including one here in Utah, are designing ways to improve handoffs when caregivers transfer critical patient information to each other.
As Ed Yates reports, any piece of information that falls through the cracks can jeopardize a patient's care.
Hey, are you going to order lunch?
Registered nurse Lynn Colgren is one of many taking care of patient Stan Halverson. Whether his condition is simple or complex, she can omit no details when passing information to the next nurse coming on duty.
Any piece of that information that isn't provided could cause injury or delay in care.
In that exchange, the nurse leaving is the giver, while the nurse coming on duty is the receiver.
If the receiver doesn't get what they want from the giver, we have right there, we know what questions to ask.
Across the hall or down the corridor, the same thing must happen all the time, every day, among everybody involved. A single patient in a hospital room like this, say in a 3-day stay, could see as many as 25 different healthcare workers in shift changes, including nurses, therapists, and physicians.
The opportunity here is to weld all of that information together so that whoever is making the next treatment decision has the benefit of all of that information.
Can you come down to the conference room for a minute?
This handoff, as it's called, is critical and needs not just computer data alone, but a one-on-one, face-to-face verbal exchange.
He had cabbage in 2000. He's diabetic.
And he's 81. He's here for acute renal failure.
Among 10 U.S. hospitals working together to improve these handoffs, LDS Hospital is among 5 actually piloting techniques that could become a standard for the country. All healthcare workers here are using a form to make sure nothing is omitted.
Built-in redundancy. I can't forget. I can't forget. If my boxes aren't filled up, that's something I don't know, I will ask and get an answer. And sometimes the answer is, I don't know. But at least I know that it's been addressed.
So far, LDS Hospital's protocol has reduced communication problems by 50%. The organization, called the Joint Commission, that accredits and certifies 18,000 healthcare organizations across the country, wants more efficient handoffs. That's why it asked the 10 selected hospitals to work together on this project. Ed Yates, KSL-5 News.
Some of the other 9 selected hospitals include the Mayo Clinic, Johns Hopkins, Massachusetts General, and Stanford University Hospital and Clinics.